So thanks for joining us. We're excited to share all of our information with you. It's mostly going to be like a sampler platter of different topics to give you an idea of what pelvic floor physical therapy can help with and what different types of conditions we can help. So the big three are pregnancy, postpartum, and Sarah is our in-house pediatric specialist who can help with pelvic health as it pertains to kids. So I will start with the pregnancy stuff. So these are the topics that we're going to discuss today. Just some quick tips on how to manage common discomforts. A lot of that is related to the postural changes with pregnancy, pain management, and then core strengthening. A little bit of background on how to do that and how to manage as the belly grows. Oh, it blinks at me when somebody's in the waiting room. I don't know if it blinks for you guys. Anybody see that? Okay, so you can let people in. Okay, so postpartum, there it is. Postpartum, these are the topics that Linda's gonna go over. So how childbirth affects the pelvic floor, and then early recovery and some common symptoms people experience then. And then Sarah's gonna talk about bladder issues with little baby kids, and so how the bladder works, healthy bladder habits, some common symptoms and difficulties with that. All right, so this is a visual representation of the most common changes that we see during pregnancy. Obviously, as the belly grows, the abs stretch, and that tends to put pressure on other structures. So the biggest thing to take note of is that the spine, the curves of the spine become accentuated. So as you can see in the first photo, that's more of a neutral posture, and then towards the end of the pregnancy, things become a little bit more S-shaped or pronounced. And what that does is it places excessive strain on different tissues. So with more curvature of the spine, you notice that the head comes a little bit more further forward. And then the pelvis itself, which is shaped like a bowl, tends to tilt more forward, which then accentuates the dip in the low back that naturally is there anyway, just becomes a little bit more pronounced. So with that, you can have a lot of back pain, hip pain, even some head and neck issues like headaches and TMJ or jaw issues. Which is something not everybody thinks about, but it is commonly related. And then if you look at the second image, you can see the rib cage and how it goes from a nicely kind of compact position to a fanned out or flared position. And part of that is because of the increased pressure from the growing baby that elevates the diaphragm and pushes the rib cage out. So by the end of the third trimester, you actually have less breathing capacity from the diaphragm because of how much pressure is pushing upward against it. And then thinking about lower towards the ground, you usually see a wider base of support with the end of the pregnancy because of the changes happening in the pelvis and changes with gravity. Usually it's just easier to stand with a wider base of support for just for endurance and all of that. So you also see kind of like that waddling type of walk that happens towards the end. But what that does is it places an increased demand on the stabilizing muscles and tissues of the hips, the feet, the ankles, and the groin. So all these things are natural and they happen mostly towards the end. And you will see some common discomforts, and what you can do to help with those things are to kind of think about what's happening and almost try to reverse it, not in a rigid way, but more so in just an awareness way, and trying to do things to narrow the base of support, or at least practice doing that. If you feel like you're slouching or your head's coming forward a ton, working on exercises that are thinking about things that open up the chest and flatten the mid-back. Even some nice rotations for the upper back is helpful to do to keep the mobility up there. And then the common discomforts, okay, they're listed here. So common areas of pain during pregnancy, obviously the low back and the pelvis, that's just a given. So you have some pain in the back, in the spine, or you can have it in the SI joints, which are the joints that connect the pelvis from behind. So I took this from the clinic today so that we had it. So this is the front of the pelvis, and there's the pelvic inlet, and then underneath is the pelvic outlet. And then from the back view, you can see that the sacrum, which is this piece of bone here, gives rise to the spine and connects to either side of the pelvis or the hip bones. So these joints that connect the two can be a source of pain, and that's usually when you are transitioning from either sitting to standing or from one leg to the other, because that's where all the force from gravity and from the ground comes through. And then in the front side, you have the pubic bone. So the pubic bone is actually fairly large. Everybody thinks that the pelvis sits in the body like this, but it's more so tilted slightly forward this way. So the pubic bone creates almost a shelf for the bladder and the pelvic contents inside. So again, because that's where the front side of the pelvis meets, anytime you're transitioning from one leg to the other or from one position to another, you have that dissociation between the legs. So there can be some pressure and some pain along the pubic bone. And again, I mentioned earlier that the head and the neck are involved with those changes in the spine. So you might see some increased headaches, you might see some jaw pain. A lot of that is from the head coming forward and how that puts a lot of pressure on the muscles in the back of the head. So you can massage the head, you can massage the jaw, but it really comes down to kind of correcting that posture in the mid and lower back to undo that forward translation of the head. And then moving towards the outer body parts, so feet and the hands, people kind of forget about those, but it's not uncommon to think or to see plantar fasciitis, which is pain usually at the heel or at the bottom of the foot. And again, because of the widened base of support, that creates widened stance. So now you have a lot more pressure on the arches of the feet. And without proper hip strength and mechanics up the chain of the lower half of the body, you can see excessive strain on the plantar fascia. And then things like carpal tunnel are also a thing. If you've heard of mommy thumb, that's a euphemism for a strain of one of the tendons in the wrists along the top side of the forearm. So those are fairly common. Carpal tunnel has more to do with the swelling and the increased fluid in the body during pregnancy, which can create pressure on the nerves and cause some numbness in the hands. So same thing can happen in the feet. And then management for these things. So it's really hard to just give a blanket statement of how to address symptoms and discomfort across the board because everybody's anatomy is so different. But just on a general level, for the low back and the pelvis, you really want to think about keeping flexibility above and below the low back and the pelvis because that's already so flexible throughout pregnancy. So keeping the upper back mobile with either foam rolling or stretching for the shoulders and the chest, rotational stretches, upper mobility, and that kind of thing. For the head and the neck, again, I talked a little bit about the posture already, but making sure that we try to reduce or minimize how often our neck is coming forward. So strengthening the muscles of the shoulder blades and the back, the mid back is going to be helpful for that. And then for the feet and the hands, you want to just strengthen around the hips and the core, make sure you're keeping good posture, and then using compression garments as necessary, which I'll talk about in the next slide. And then just modifying activities. So going upstairs, you might want to take half the flight and then take a little bit of a break and then do the rest of the flight. So depending on how far you are into pregnancy, sometimes it just takes a little bit of cleverness on how to adjust whatever it is that you're doing. Okay. So if we go on to constipation. So constipation is definitely common in pregnancy. Part of that is due to hormones. So the hormones slow down mobility through the intestinal tract, and metabolism also changes. So the other common causes are dehydration and differences in dietary intake. So different foods can change the consistency of stool, which can make it harder to pass or just slowed in general. Symptoms include straining on the toilet, so holding your breath, pushing really hard, taking longer than 10 minutes to empty, like things just aren't coming out smoothly, or the consistency looks like pebbles or hard cracked stool. So there's a nice chart right there called the Bristol Stool Scale. And ideally you'd have your bowel movements close to a type 4. So that's when it's formed, but it's soft and it's smooth, versus types 3 and 2, which are a little bit more cracked. And then types 5 and 6 and 7, which are a little bit fluffier or almost to the consistency of liquid. So if you are closer to a 1 or a 2 or a 3, that can be a sign that you're constipated. And then one more other symptom that's common in pregnancy is hemorrhoids. So this may or may not be related to constipation because there's just so much more blood produced in the body during pregnancy that the veins typically swell, especially around the perineum or at the base of the pelvis because of all the pressure. So that might be there just in general, but definitely if you are constipated and straining, then hemorrhoids can be a common side effect of that. So chicken or the egg with the hemorrhoids. Management of constipation during pregnancy includes improving the consistency. So if you can get it to be less of a type 1 or 2 and more of a type 4, that'll already help with at least the passing. And the way to do that is to look at your fluid intake. So how much water are you drinking, and what kind of foods. So we, at the clinic, we give a list of foods that either thin the stool versus thicken the stool. So things that thicken the stool would be your starchier foods, your high fiber foods like oatmeals, rices, pastas, breads, versus the foods that thin the stool, such as leafy greens, dark chocolates on there, which everybody's a fan of. Red wine also thins the stool, and sometimes caffeine can also help with that. So depending on what you like to eat and what your routine is, you might want to just consider kind of balancing out how many laxative foods versus how many constipating foods you're eating. And then squatty potty. So we're big fans of the squatty potty. So one thing that helps with emptying the bowels is making sure that you're set up for success on the toilet, which I'm sure Sarah will talk a lot about for the little kids too, because childhood constipation is also common. But definitely want to set yourself up so that you're relaxed and your feet are supported to the point where your knees are higher than your hips. So basically you're in a squatting position without holding your legs up physically, by bringing the ground up to you through a stool like the squatty potty. And what that does is it places your pelvic floor muscles in a position where they can relax a little easier. So that also helps with emptying. And then for the bladder, one of the common, or a few common symptoms during pregnancy is obviously urinary frequency, a little bit of urgency, and maybe even some leakage. So all these things, depending on the person, there are a lot of reasons why they happen, but the most obvious is because of the pregnancy. There's all this pressure on the bladder, right? So with a growing baby, the bladder has a little less room to stretch and fill. And also when it is full, there's something on top of it trying to push things out. So give yourself a little bit of credit with this one, because sometimes it's just a matter of pressure and gravity. But needing to void frequently, so more than every 1.5 to 2 hours in between leakage with coughing, sneezing, laughing, or that's triggered by either the sight of a toilet or the restroom, or hearing or seeing running water is a common complaint. And then also feeling like you can't fully empty, or you feel like you're done and then you stand up and then more comes out, or to get the flow started, you have to really push or strain to void is also common during pregnancy. Again, everybody's a little bit different. You may have one or more or none of these, but the management for these is to make sure that you have good bladder habits. So emptying regularly. So anywhere between 2 to 4 hours is ideal. So you want to hold for 2 hours at least. You can get to 4 hours usually, but that's on the tail end where the bladder is usually a lot more full. So it's definitely harder. So if you look at that image on the side there, you have a cycle starting at the top photo where the bladder is filling, and then as the bladder stretches, it sends a signal to the brain that there's something in there, it needs to empty. But usually that first urge, or I call it a knock on the door, is just that the bladder is maybe around halfway full, a little less than that. And as it fills, then the brain warns you again that, oh, it's a little bit more full, there's more weight here, there's more pressure, which is where you see that transition from the bottom picture to where it's really full to where it empties on that left-hand side. So you want this cycle to happen over the span of 2 to 4 hours, but that can obviously change if you're drinking a ton of water, or maybe if you are stuck traveling and you have to hold for longer than a couple of hours. So there's some wiggle room there, but ideally 2 to 4 hours to keep everything happy and your pelvic floor muscles happy, because the longer you hold, the harder your pelvic floor has to work. And over time, that can also cause some issues of overactivity. So to manage any leakage, people usually think of Kegels, which may or may not be true, because Kegels are just one function of the pelvic floor muscles, which is when they squeeze. But if you think of emptying, the pelvic floor muscles actually have to relax. So you want to train both strength and flexibility, and coordinating when that's supposed to happen. For example, when you're coughing or sneezing versus if you're on the toilet trying to empty, right? So 2 different things, but same pelvic floor muscles. So if that's something that's an issue, that's one of the things that we can evaluate with you during a pelvic floor examination to make sure the muscles are doing what they need to do. Because again, everybody's a little different. So that's the bladder. And then for pain management, so we talked about back pain, some hip pain, some pubic bone pain. Again, it's really hard to give just a generalization of what can help with pain during pregnancy because it's really, it depends on the individual person and how the symptoms behave. But two of the things that we give almost every pregnant person that comes in is teaching them how to activate their transverse abdominis and activate their pelvic floor, both to squeeze and relax. So if you look at that bottom pair of images, those two people laying down, I guess it could be the same person. On the left side, you have somebody inhaling or taking a deep breath in, and you can see how the trunk, which is made up of the abdominal wall, the pelvic floor, the spine, and the diaphragm, everything kind of expands like a balloon filled with air, and that creates a relative downward pressure on the pelvic floor. So if you right now take a nice deep breath into your belly and let everything expand, hopefully you feel your pelvic floor muscles release. Then as you exhale, think of how a balloon deflating would shrink together. That's when you'd want to do a Kegel or squeeze as if you're stopping the flow of urine. So as that happens, inhale to release some pressure or to increase the pressure and release the tension in the pelvic floor. Exhale to squeeze the pelvic floor and do the Kegel as everything shrinks together. So if you have trouble doing any of those two, or maybe you have a hard time feeling one or the other, that's the type of stuff that we go over in a pelvic PT session to make sure that you understand and have the confidence in how to do that properly. Now for the TA or the transverse abdominis, we definitely want to engage those muscles because they are at a disadvantage just by the stretching of the baby. So a couple of things that we give people to think about is tensing the belly muscles as if they're putting on a tight pair of pants. So if you look at that image on the top side, on the right, you can see that the belly goes from relaxed and nice and soft to just gently pulled in and flattened inward. So we tell people to imagine hollowing out the belly or shrink wrapping the belly in. It's different than a crunch, it's different than tucking your pelvis, and it's different than doing like a sit-up. It's very subtle, and the muscles basically hug inward and pull towards the spine. I usually tell people to imagine what it's like when somebody's going to tickle you and you pull your belly muscles slightly in. It's that inward pressure. So you can practice that during pregnancy, and I think it's actually easier to see this on somebody who's pregnant because we tell them hug the baby. So when you hug the baby in towards your spine and up towards your ribs, you can see that movement, and it's really subtle. And then when you let it go and you inhale again, you see the belly expand. So combining that with the pelvic floor, right before you do anything that's transitional, so before you get up out of a chair or before you turn in bed or before you go up a step or down a curb, you can gently hug the baby in and engage the pelvic floor and start trying to time that and see if that changes your pain, because then that gives you more of an idea of if it's a weakness or a stability issue. So just one thing that you can start to try to do if you're pregnant, and then if you have any confusion or questions, definitely consider talking to a pelvic PT about that. So last thing is for pain management is you want to have the option of having some external supports if you are able to get your hands on them. Belly binders are good for later in the pregnancy when you just are so tired and you don't have the endurance to do a ton of exercises, and you're just on that tail end of that last trimester. So a couple of good ones. The tan one is called the Better binder, and it has those two straps. And then the one on the left, I forget what it's called, but it has the giant underbelly wrap and then the top strap to connect it. Both are very comfortable. It's a personal preference, but these are great because as the belly grows, you can just adjust the two pieces or the two straps to make it comfortable. The bottom one is a SI belt or a sacroiliac belt, and the brand is Sorolla, and that goes around the pelvis. So you don't want it to wrap around your low back up here. You want it to wrap mostly around the pelvic girdle to, again, support everything in. As hormones circulate and makes this all really loosey-goosey, the belt helps to provide a little extra stability just throughout the day. So that's another option. And then really consider compression garments for all the swelling. So they make there are socks, I believe, that you can wear on like airplane flights so your ankles don't get too puffy. Same thing for pregnancy. If you know you're going to be on your feet a ton, sometimes that's really helpful. And then for footwear, again, because of that widened base of support and the tendency to put more pressure through the arches, a lot of people don't think about their flip-flops, because I know at least here in Southern California, everybody's in flip-flops all the time, but those don't have the greatest arch support. So using or changing up the footwear, depending on what you're doing, to be supportive versus really flat. And then bra selection. So this is more for the bras that are, I guess they're the dressier bras that just have the 2 straps above it. Just thinking about how much the breasts develop during pregnancy and how much the spine curves. Sometimes just changing the bra is a great option. So bras that have more fabric on the back, so that racer back type of style where it can spread a lot of that support across the back versus on the straps, is something that a lot of people don't think about that can help with any upper back and neck pain. So yeah, different options depending on where you're feeling any symptoms, and talking to one of us. If you're experiencing anything specific, we can help guide